Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com, Saxenda vs Ozempic, for weight loss. Key points. Saxenda and Ozempic are both glucagon-like peptide 1, GLP-1, receptor agonists, but they are approved for different health conditions. Both Saxenda and Ozempic can cause weight loss, but only Saxenda is FDA approved for long-term weight management. Ozempic is approved to treat type 2 diabetes and to lower the risk of major cardiovascular events in adults with type 2 diabetes and heart disease. Saxenda and Ozempic are both injected under the skin. Saxenda is injected once a day, while Ozempic is injected once a week. Nausea, diarrhea, and constipation are common side effects of both Saxenda and Ozempic. A large review of different studies suggests Ozempic may be more effective than Saxenda for weight loss. How do Saxenda and Ozempic compare for weight loss? Saxenda, Liraglutide, and Ozempic, Semaglutide, can both cause weight loss. However, only Saxenda is FDA approved for long-term weight management in people 12 years and older. Ozempic may be prescribed off-label for weight loss, and there is a brand name that contains the same active ingredient, Wegovy, that is FDA approved for this use. Clinical studies of Saxenda. Adults taking Saxenda lost 5% to 7.4% of their starting body weight after 56 weeks. This is compared to the placebo groups which gained 0.3% of their body weight or lost between about 2% to 3% of body weight depending on the individual study. In one clinical study, people taking Saxenda, 2,487, lost about 7.8 kilograms, 17.2 pounds, after 56 weeks. Children taking Saxenda lost 2.65% of their starting body weight, 2.6 kilograms or 5.7 pounds, after 56 weeks. This is compared to the placebo group gaining 2.37% of body weight. Clinical studies of Ozempic. Adults taking Ozempic lost 3.8 kilograms, 8.3 pounds, to 4.7 kilograms, 10.3 pounds, after 30 weeks. This is compared to the placebo group which lost 1.2 kilograms, 2.6 pounds. A recent meta-analysis, a type of statistical study used to combine the results of multiple clinical trials to answer a question, and systematic review found that semaglutide caused more weight loss than liraglutide. Specifically, people taking semaglutide 2.4 mg lost about 12.5 kilograms, 27.5 pounds, and people taking liraglutide 3 mg lost about 5.2 kilograms, 11.5 pounds. The studies reviewed ranged from 20 to 68 weeks long. What are the differences between Saxenda and Ozempic? There are many differences between Saxenda and Ozempic. Not only are the two medications approved for different conditions, they are dosed differently and have some unique side effects. Several key differences are highlighted in the table below. Saxenda. Ozempic. Active ingredient. Liraglutide. Semaglutide. Drug class. GLP-1 receptor agonist. GLP-1 receptor agonist. FDA approved uses. Add-on to diet and exercise for chronic weight management in adults with a body mass index, BMI, of 30 kg/m2 or greater, or 27 kg/m2 or greater with at least one weight-related condition, for example, high blood pressure, type 2 diabetes mellitus, or dyslipidemia. And children 12 years and older with body weight above 60 kg, and a BMI corresponding to 30 kg/m2 for adults. Add on to diet and exercise to improve blood sugar control in adults with type 2 diabetes. To lower the risk of major cardiovascular events in adults with type 2 diabetes and heart disease. Route of administration. Subcutaneous injection. Subcutaneous injection. Injection frequency, once a day. Once a week. Side effects, nausea, diarrhea, constipation, vomiting, injection site reaction, headache, low blood sugar, indigestion, nausea, diarrhea, vomiting, stomach pain, constipation. Related questions: what are 4 key Ozempic side effects to watch out for? Mounjaro versus Ozempic, how do they compare? How do Ozempic, Mounjaro, Wegovy, Zepbound compare for weight loss? How do side effects compare between Saxenda and Ozempic? The most common side effects for both Saxenda and Ozempic are gastrointestinal, digestive tract, side effects. These include nausea, diarrhea, and stomach pain. Your healthcare provider will start you at a low dose and slowly raise your dose as you tolerate the medication to help lower your risk for side effects. Saxenda. The most common side effects in people using Saxenda for weight management were nausea, 39%, versus 14% placebo, diarrhea, 21%, versus 10% placebo, constipation, 19%, versus 9% placebo, vomiting, 16%, versus 4% placebo, injection site reaction, 14%, versus 11% placebo, headache, 14%, versus 13% placebo, low blood sugar, 13%, versus 7% placebo, indigestion, 10%, versus 3% placebo, fatigue, 8%, versus 5% placebo, dizziness, 7%, versus 5% placebo. Other side effects reported from taking Saxenda included stomach pain, burping, gas, and trouble sleeping. Ozempic. The most common side effects in people using Ozempic for type 2 diabetes were nausea, 16% to 20%, versus 6% placebo, vomiting, 5% to 9%, versus 2% placebo, diarrhea, 9%, versus 2% placebo, abdominal pain, 5% to 7%, versus 5% placebo, constipation, 3% to 5%, versus 2% placebo. Other side effects reported from taking Ozempic included low blood sugar, increase in heart rate, dizziness, fatigue, and injection site reactions. Note, these are not all of the reported side effects, precautions or warnings for Saxenda or Ozempic. Speak to your healthcare provider if you have questions about drug side effects. How are Saxenda and Ozempic given? Saxenda is injected under the skin once a day, while Ozempic is injected under the skin once a week. For both medications, the dose is started low and you will slowly taper up to avoid side effects. For Saxenda, you will typically start taking 0.6 mg daily for 1 week. Then, your dose will be raised by 0.6 mg each week until you are taking 3 mg every day. For Ozempic, you will typically start taking 0.25 mg once a week for 4 weeks. Then, your dose will be raised to 0.5 mg weekly for 4 weeks. After that, your healthcare provider might raise your dose to 1 mg for 4 weeks and then to 2 mg once a week. Your dose will depend on how you tolerate the medication and how well your blood sugar is controlled. Can you take Saxenda and Ozempic together? No. Both medications are injector glucagonlike peptide 1, GLP-1, receptor agonists, and the safety of using them simultaneously is unknown. Even though Saxenda and Ozempic are used to treat different health conditions, they should not be taken at the same time due to the increased risk of side effects. Some potential complications of taking Saxenda and Ozempic together include the risk of low blood sugar and pancreatitis. How to switch from Saxenda to Ozempic, or Ozempic to Saxenda. In some cases, your healthcare provider may recommend switching from Saxenda to Ozempic or the other way around. One large difference to get used to is how often you take the medication, since Saxenda is injected once a day while Ozempic is injected once a week. Follow your doctor's instructions carefully on how to change between these two medications. In general, if you are currently taking Saxenda and will be switching to Ozempic, start taking Ozempic the following day after your last dose of Saxenda. If you are not switching medications because of side effects, your doctor might have you take the medium dose of Ozempic, 0.5 mg once weekly, and taper it up from there. If you are currently taking Ozempic and will be switching to Saxenda, start taking Saxenda 7 days after stopping Ozempic. Your doctor may recommend an equivalent or lower dose of Saxenda depending on the reason you are switching. If you are changing medications due to side effects, your healthcare provider might ask you to wait until the side effects resolve before starting the new medication. It is recommended to start with the lowest dose of the new medication and slowly raise the dose to the target dose. This is not all of the information you need to know about Saxenda or Ozempic for safe and effective use and does not take the place of your doctor's directions. Follow up with your healthcare provider to learn more. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.